Hi everyone, my name is Sally. I'm the owner and trainer for Disabled Advantage Dog Training. This is the second post for my newest video series, Why It Matters, which focuses on specific training skills or lifestyle choices we might make with our dog that are especially important if you live with chronic illness or another type of disability because of the ways it ties into not only the dog's well-being and helping to create a balanced dog, but really getting into why it's important and why it impacts our chronic illness, chronic pain, disability, whatever we have going on, because maybe it limits a certain flare or limits a certain symptom from happening, or it enables us to ask for help easier or faster from our dogs. And these are things that most dog owners and most dog trainers are not talking about because so much of dog training is focused on we're doing it to solve a problem or we're doing it to accomplish a specific goal with the dog. A lot of it is focused on the dog, what the dog is going to look like in the end. And when we do talk about owners, we talk about owners in terms of giving you more freedom, giving you more independence, being able to go places with your dog, whether that's pet-friendly places if you're a pet owner, or to non-pet friendly places for service dog teams. But we don't really necessarily talk about the why. And some trainers don't like getting into the why, and that's perfectly fine. But in my work with individuals with especially complex regional pain syndrome, the why matters. It makes a huge difference because it's not just about training a dog for making the dog easier to live with or solving a behavioral problem. It's about creating harmony between the dog and some aspect of our chronic illness, chronic pain, disability, etc. So that is a quick recap on what this podcast is about, what this video series is about. I apologize for the very long delay between the first one that I did on doorway manners a few months ago and this second one now. It has been a hell of a year. I started the year, thought it was going to be fine, but then got the flu, and the flu plus CRPS is horrible. Don't recommend it. And then I kept having the flu caused my ribs to sublux, twist, whatever ribs do, multiple times. And so that made it really hard to talk and breathe. So making a video post was not going to happen. And along the same time, I started getting back into walking. My right patella kept subluxing in and out of alignment, and that was really painful. And then February came and I had a dental cleaning that went sideways, and horrible CRPS TMJ flare that actually kept me from talking and eating solid food for about a month. But that is all in the past. I'm back. I'm talking again, as evidenced by this video, and I'm going to try and get back into making these video posts. Now, I do have a full roster of clients right now, which is taking up a fair bit of time, but I feel like this video series is very important to owner trainers and also all the owners I'm not able to work with one-on-one who are either pet owners or training a service dog. So here goes. The second post for Why It Matters is I strongly recommend owners teach a designated bedtime spot, and for that designated bedtime spot to be either your crate or a place blanket or a combination of the two, especially if you like to travel or if you are someone who house sits for friends and family. in regards to broad spectrum training a dog, having a designated bedtime spot is a safety feature for your dog, and it also aids in the overall big picture training of your dog. It helps your dog learn impulse control, which is the ability to not do whatever you want, basically. It teaches your dog how to be okay with being confined, how to be okay with being in one spot, and how to, even if the crate door is open, how to wait for a command to leave instead of just barging through the crate. And learning that impulse control of waiting at the crate door until they're given a cue to leave carries over into other areas of working with your dog. It carries over into doorway manners, which we talked about last time. It carries over into the ability to hold a command for a longer period of time, to wait for their food without jumping on you or barking or paw striking you. It carries over into a lot of different things. So if you can introduce a crate into your dog's lifestyle, it will help with the rest of their training. Now, you still have to do the work. It's not magic. It doesn't just transplant the thoughts into their brain while they sleep in there, but it does help with a key component of training your dog, impulse control. Having them sleep in their crate at night also means that you're preventing destruction. You're keeping the dog safe. I mean, if your dog is a crate destroyer, that's a separate problem. But as long as your dog is not a crate destroyer, keeping your dog confined in their crate overnight means that you can actually sleep in peace without having to worry about finding your home in pieces when you wake up, because your dog went around and destroyed things because you weren't awake to reinforce the rules or tell them no. And this also just helps keep your dog safe when they're learning. It's a place to keep them when you leave the house. That goes for pets or service dog owners. Initially, we're not going to be taking our dog everywhere. They need a safe place to be. And so the crate is a key place to include in your training. As far as placemats go, placemats also help us teach our dogs impulse control. Stay on this blanket until I ask you to leave or tell you you can leave. And place is really nice because it can be generalized to a bunch of different areas. You start with one and then you add more as the dog understands the command better, and it's something that's very easy to pick up and take with you. A lot of owners carry a blanket that their dog can lay on in public or when they go to friends and family's homes or when they're outside, and it just helps keep the dog in one place, teaches that impulse control. Again, the blanket is not magic. You have to do the work teaching your dog these things. But from an overarching training standpoint, a crate and place training are both really, really useful skills for your dog to know because they help carry over other skills to your dog's training and life. But why this particular thing matters for life with chronic illness, and in particular, aside from how you use your crate and your placemat during the day, picking a designated bedtime spot and it not necessarily being your bed is extremely beneficial. I know a lot of people like sleeping with their dogs in their beds. I am not here to argue with that point. I am here to suggest that in the beginning of your dog's learning, they learn they have a bedtime spot and you have a bedtime spot, and those are not the same place. There's a lot of issues that can come up with a dog in a bed. Still not going to touch that in this post. That's something I'd rather talk to people one-on-one about because it varies so wildly. I personally don't like sleeping in the same bed with my dogs because I did when I was a kid. But I made so many mistakes with that dog. I don't like sleeping in bed with my dogs because my dogs have been large dogs for mobility work. And Robbie used to outright run in his sleep, full legs galloping in his sleep. And so I usually have the dog on the bed for an hour or two at night as like a end of day snuggle type deal, or if I'm really cold and they're helping me, or if there's a storm going on, they might be on the bed with me doing task work. Um, but Robbie would run, and he would eventually get tired of snuggling. Like, he wanted his own space. And so he liked sleeping in his crate at night. He liked having a place where he could stretch and he could change position. Um, I don't like being stepped on, so my dogs have to be really careful when they're laying in close proximity to me that they don't step on me, that they don't add an extra pain flare to me. And then Austin, being part husky, he overheats really quickly. So a lot of times he'll be on the bed and then he'll overheat and he needs to leave. And same thing with him. He likes to be able to stretch out. He actually really likes sleeping on his back, which is not super safe to do on our bed. So in our house, the dogs don't sleep on the bed in the night. And even if we did like it, and even if it was less of a pain risk to me, we still wouldn't do it because it's just he's a giant dog and we all want our own space. We like having that freedom. But when you train a specific designated bedtime spot, and this does tie back to people who sleep with the dog in the bed might stay in the bed all night, they might change position, but they might also get up and leave. And then they might go to one spot, which is fine, or they might alternate where they are in the house. And if that happens, you don't know exactly where they are. So if you wake up in the middle of the night and you need help from your service dog, you don't know where they are. You know they're somewhere in the house, hopefully, but you don't know exactly where they are. And when you teach a designated bedtime spot, especially if it's a crate or a placemat that's in your bedroom, that's in line of sight for you when you're in bed, you can wake up in the middle of the night in a pain flare, pain insomnia, you had a pain nightmare, you're having a different kind of nightmare, you're having a mental health episode, you're having a medical episode, whatever's going on, you can wake up in the middle of the night and you know exactly where your service dog is. You know exactly where help is, and you can expect and depend on them being in that spot. And it might sound trivial, but as someone who has woken up in the middle of the night terrified because of a nightmare I had, or sometimes waking up screaming from how much pain I'm in, it is instantly calming to be able to look to where my dog's crate is and know that they're there if I need their help. And unfortunately, service dogs do wake up at the same time we do. And if we are having trouble sleeping, they usually switch into work mode and are alert on us. If you know where help will be in the middle of the night, it means, and help might be just looking at them. That's not a task. I want to be really clear. That's not a task. That's just a comfort thing. But task-wise, help would be being able to call them to your bedside to help you get out of bed, walk beside you to go to the bathroom, turn on lights so it's not dark in the house, get up in bed with you to help do deep pressure therapy, deep cold therapy, leave their crate or their place to come interrupt if you're starting to get tremors or having a medical episode or whatever's going on. The dog is within 10 feet of you. They can immediately focus on you and immediately come help. It means that it's easier to ask for help. It means that you don't have to spend energy looking for where your dog is or calling them. If you are in severe pain, it's very difficult to talk. And I have taught Austin multiple recalls so that even if I'm in pain, I have a bunch of different ways to call him. But there have still been times where I'm in so much pain that I can't do any of them. And it's really helpful if he's close and I can do something as small as just twitch my fingers a little bit. And he's close, he's focused on me, he sees it, and he gets up and he comes to me. But if he's, somewhere else in the house, he's not going to see that. And you don't have to wake up your partner if you're sleeping in the same bed as somebody else or in the same room as someone else. You don't have to worry about waking up your partner trying to call the dog if you are trying to call them verbally or with a clap cue or something like that. Additionally, I recommend, as like a side note to that one, having the crate either. I've spoken with teams who had smaller dogs, and they would actually have the crate on a raised platform beside the bed with the door open so that it was really easy for the dog to come onto the bed, but then really easy to go back into the crate. I liked that idea for smaller dogs. But if you have a larger dog, having the crate like a little ways away from your bed or having the place blanket a little ways away from your bed so that as a secondary thing, one, they're in a designated spot, but like 1B is that you're not tripping over them. So if you do get out of bed by yourself, and then you ask for help, or then they come over and do a task with you on the floor or something, that when you swing your legs out of bed, you're not instantly tripping over your dog. So put the designated bedtime spot a little bit away from your bed. Close, but not super close. And if you don't have a designated bedtime spot, your dog might instinctively choose to be closer to you, but sometimes the place where they choose to be instinctively close to you is unfortunately a trip hazard. They put themselves right beside the bed or right at the foot of the bed. And so you're wandering around in the dark looking for your dog to come help you, and then you fall on them. And that's not what we want either. So that's one reason to teach a designated bedtime spot. You know where the dog is, makes it a lot easier to ask for help and less hazardous to you to ask for help. The second reason is that if you have, so you've got the designated bedtime spot. If you've trained your dog up to where you can leave the crate open at night and they stay in the crate all night until it's morning or until you ask them out of your crate in the middle of the night, or they sleep on a place blanket at night, it makes it really easy for them to automatically do tasks. They see you having they wake up, they see you having a nightmare. They voluntarily, intelligent, disobedient, leave the crate, leave place, and come to you and wake you up, interrupt your nightmares. Or a timer goes off in the morning to help you get up and start your day, but maybe you don't hear the timer, maybe you can't hear the timer, maybe you have trouble responding to timers and you need actual stimulation of some kind. The dog can, intelligent, disobedient, leave the crate, leave the place blanket, come alert to the timer, wake you up, get you moving, get you grounded to present and fully awake. That's something that, again, yes, your dog could technically do it even if they don't have a designated bedtime spot, but having the designated bedtime spot keeps the dog closer, keeps the dog easier at hand, and when they're closer, when they're easier at hand, when they're reliably closer, they know and they learn to keep an eye out for these things. You train these specific things, and if they're in another room, they may or may not be able to tell if a nightmare is happening. They may or may not hear a timer go off. They might be like, maybe I don't have to respond this time. When they're in the same room with you, their focus on you is typically a lot higher. The third reason is that having a designated bedtime spot translates really, really well when you travel. And we have when you travel or when you do a hospital stay. And we've experienced this in a lot of different ways. We have gone on vacation with our service dog. I've been to the hospital and had an overnight stay with my service dog. We've done house sitting for a friend with our service dog, and it's just not practical to take the crate with us. And what we would do instead was we would take a place blanket. And the way we taught this was, it's a little bit confusing, and you might come up with a better system, but this is what we came up with. So we have the word place, which means go to a specific mat that we're pointing to. We have the word kennel, which means go in your crate and stay there until you're released. And then we have the word bedtime. And bedtime in the beginning of our dog's training is applied specifically to the crate. So every single time one of us puts the dog to bed at the end of the night, they've gone out for potty, they've had their last water of the day, we guide them into their crate and we say bedtime. So instead of saying kennel, we say bedtime. And so the dog associates the word bedtime with, it's the end of the day, I go to this place that they're directing me to, this is bedtime, I'm going to stay here all night. And it's only used at bedtime, so it helps link that association. When we travel, we follow a similar pattern. So we usually, we're in one room, we shut the door. So if the dog does leave their placemat, they really can't go anywhere. But we put their bedtime placemat out, we say bedtime, and we point to it. Dog goes to this bed, and that's where they sleep all night. And Austin does a really good job with it. Robbie would sometimes, I'd wake up in the middle of the night and he'd be like walking in between two placemats. And I could tell because I would see his tail, kind of like a telescope, or not a telescope, a periscope across the edge of the bed. But he would at least go from placemat to placemat. I think it was just his way of getting up and stretching in the middle of the night, but he would stay on place during the night. And this is really helpful because, first of all, when you travel, being able to translate that to a place blanket makes it easier to travel, just period. So you still have the security that you have at home of knowing where your dog is and them being close to you, but not underfoot, and them being able to immediately come help you in the middle of the night with a lot of ease for you. When you're traveling, when you're in the hospital, you're usually more stressed out, especially if you're in the hospital. But when you're traveling, even on vacation, we tend to be more stressed out because we're out of our home environment. Our home environment is a place that has been, to the best of our abilities, customized to our level of accessibility, what we need to make our disability manageable and more tolerable. And when we're someplace new, that accessibility feels a little less out of reach. Or feels a little more out of reach. Feels more out of reach, especially if we're in a hospital, because the nurses are trying to do the service dog's job, which may or may not be safe for us. And we especially don't feel safe. Maybe we're on a lot of drugs, we're in a hospital gown. It's just a very vulnerable situation. It's not our bed, it's not our pillows, we're there for whatever terrible reason. It's just not great. So having one thing that helps maintain a level of constancy for us from home can be, our service dog has a designated bedtime spot. We know where our service dog will be. We know they'll be close to us. We know it'll be really easy for them to help us. And so that brings a little bit of our home accessibility with us wherever we travel. For the dog, It provides them with a known comfy spot that will help them relax and help them feel a little bit more comfortable and at ease. Yes, a good service dog is resilient and is going to hold up to stressful times. That does not mean that they're impervious to stress. That does not mean that they won't get uncomfortable. They will like having something that smells like home, that smells like them, and that they associate with, okay, cool, I can rest here. The fourth thing is that service dogs need a dependable place where they can shut down. And not shut down in a bad way, shut down in a good way. Service dogs are likely more sleep deprived than your average dog, because dogs are supposed to sleep a lot. Compared to our 8 hours a day, adult dogs are supposed to sleep something like 12 to 16 hours a day. Service dogs definitely are not sleeping that much. It depends on the task work that's being done. It depends on their on-off duty schedule. And as I've mentioned, if they need to wake up in the middle of the night to do task work for us, they are losing sleep. That is time when they would be asleep. But we need their help with our disability. And so it is just an unfortunate side effect of the job. But when we can give them a place, when we can give them a location that they can depend on, that they know is a place where they can go into deep sleep, where we won't constantly harass them, we won't constantly ask them to get up and change position, where they can feel totally at ease, it helps them sleep. It helps them calm their brain at the end of the day. And it helps them unwind after a day of work. A lot of times, most of the time when I come home from public access with Austin, unless he needs to be fed right away, we have some playtime, and then I put him in his crate for like an hour so that he can just nap. And he usually naps pretty solidly, because public access is a lot of mental stimulation. I think my vocal cords got out of the practice of talking for a month, and I've noticed a few bouts of where I am teaching or making a long video, my throat starts hurting. So that's what this is. This is a CRPS flare in my throat. It might sound like freedom to let your dog pick their own spot to sleep in. And when you teach place, the default setting for your dog is that they are going to learn to go to a placemat and sleep of their own volition. But if you never teach something like that, you never teach crate, you never have a specific bedtime spot, it may feel like freedom to let your dog wander through the house at night, to go from your bed to their bed, to the floor, to the kitchen, to the back porch, whatever. But all that does is it adds instability to your life and it feeds nervousness. So it's not necessarily about helping them unwind at the end of the day. Also, again, you have no idea what they're doing in the middle of the night. So when we have our service dog at the end of the day and it's bedtime, when we give them a designated bedtime spot, it does all of the things that I mentioned before. It makes it more accessible for us. It gives us comfort when we travel, and it gives the dog a really easy way to come help us of their own volition. But if we have a night where we don't need any help, what that designated bedtime spot is for your dog is a safe place to unwind and rest and relax and get a really good night's sleep. They can still stretch and get up and move and change position a little bit if you've gotten them the right crate size, but it gives them a place to go, okay, my charge is good, I can rest now. And depending on your disability, that won't be the case every night. But most of us aren't having middle of the night problems every single night, right? I know for myself, it's probably a few times a month. It's not every day. And I can't speak to other teams. If you are needing help in the middle of the night every single night, I would encourage you to find other chunks of time during the day where you can give your service dog time to just fully relax, get that deep sleep, recover, unwind, have a place where, as best as you can, you're gonna let them be and you're not gonna ask for their help. Because they need sleep in order to do their job. But I know for myself, and anthropomorphizing, but I know for myself at the end of the day of pushing through the pain and pushing through the distractions, being able to climb into my own bed with my own favorite blankets, it is my brain's cue that I don't have to be on high alert anymore. That I can take a break. Because for the rest of the day, even when I'm resting, there's still some part of me that's like ready for an unexpected flare or ready to get up and do something else. And our service dogs, especially the ones who work with people like me, where my disability is sometimes predictable and sometimes unpredictable, and so he kind of has to be like ready. People have asked when is he off duty, and there are lots of times where he's off duty, but there's also plenty of times where he's off duty where some part of him has to be ready to jump back into on duty-ness for like a few minutes or an hour and then go back to off duty. It just depends on what happened, what the flare is, etc. The other night, he was on an off-duty walk, and then I fell. And as the second I started to go down, he had to switch into on-duty mode, all of his own volition, based on training, and then stay in on-duty mode until we got home and got me in bed. And only once I was in bed did he lay down and start to settle down himself. And having the crate, having the place blanket as a designated spot for especially at the end of the day gives your dog that same safe space for them to go, okay, they're good, I'm going to go off duty. I'm going to lower my alerts, and I'm going to rest and recover and get ready for the next thing. It's not perfect because sometimes we do need their help in the middle of the night. And if you do need help in the middle of the night, I want you to ask your service dog for help in the middle of the night. Don't be worried about that. But because it's better to ask your service dog for help than to think, oh, I can do this by myself, and then something bad happens. But training a designated bedtime spot is about so much more than just creating structure for our dogs. For us, with chronic illness, with chronic pain, with disability, it is a accessibility tool that also benefits the mental health of our dog and the physical health of our dog. I will make a written blog post that accompanies this video. If you have any questions about this video or how to train this, you can leave a comment or you can send me an email. If it's a quick question, I might answer it in email, but if it's something that you want one-on-one help with, walking through a visual demonstration of how to train this to your dog, that is something that you need to sign up for a private training session with me. Like I said, I am currently full on clients. Depending on when this video gets watched, this is May of 2026. But I always have one-on-one training slots open for just one or two one-off sessions for an hour or 2 hours to work on a specific training skill, not necessarily an entire course or package. Thank you for watching this video on why it matters to train a designated bedtime spot for your service dog or pet dog when you live with chronic illness.